This presentation will go through how to perform a basic set of patient observations using the OBS machine, so looking at heart rate, oxygen saturations and blood pressure. Explain to the patient what, how and why. You will be checking their heart rate, blood pressure and oxygen levels, and possibly temperature if indicated. They will likely be very used to having these OBS done quite regularly, so you don't have to go into too much detail here. Just that you will be using the blood pressure cuff and oxygen saturation probe to check if their numbers are all as we would expect. If you are checking because you are concerned, then let them know why you are checking. For example, you seem to be working a bit harder with your breathing, so I'm just making sure your oxygen levels are okay. In terms of checking respiratory rate, that should always be done discreetly. As soon as a patient thinks that you are checking their breathing rate, they will become consciously aware of it and you will not get an accurate reading. I suggest discreetly counting this whilst obtaining an oxygen saturations reading or while the blood pressure machine is obtaining its reading. Infection control is also vital here. All equipment should be wiped down before and after patient use, preferably in front of the patient so they can be assured that correct infection control practice has been followed. There is little patient preparation involved or instructions. Generally, OBS will be checked in the position you find the patient so you can be sure they are safe to be moved. The exception is if you want to do a sitting or standing blood pressure to check for postural hypotension, or if you are checking oxygen saturations during mobility, for example. An important consideration when taking blood pressure readings is that there are contraindications to the pressure generated by the blood pressure cuff that include upper limb fractures or injury, recent surgery, active disease or pain, arteriovenous shunt, breast, axillary or shoulder surgery, casts or bulky bandages, lymphedema or known vascular disease in the arm. Let's go on now to look at how this is done practically. First, we will introduce you to the OBS machine. Okay, so let's introduce you to an OBS machine. So these will be different in every hospital that you go to, so it's really important to ask at your orientation to see one of these OBS machines and maybe for a quick demo on how it works. But they should be straightforward enough. You'll have a power button. So this one is here, and it will blink on. Attached to that should be your pulse oximeter probe. You'll see here. And we'll show you how to use that in a minute. Okay, and also attached to it there should be a blood pressure cuff. And we'll also show you how to use that shortly. The buttons on the machine, you shouldn't really need to worry about any buttons because it should automatically come up with the pulse oximetry numbers, but what you will need to do is inflate the actual blood pressure cuff. So some of the machines have start written on them and other ones just have a picture of the blood pressure cuff. So here there's a little picture and you press that and then the cuff will inflate and you'll get your reading. Now we will introduce you to how you will use this to get an oxygen saturations reading and a blood pressure. Okay, I'm going to do some observations here on Alex now. So I'm going to start off just turning the machine on with the power button here. And then I have got my pulse oximeter finger probe. So I'm going to pop that on Alex's finger so the cord side goes up. And just relax your arm for me. And we're just going to wait, that'll take a few seconds to register. You will see some lines pulsating up and down, that means that their signal is getting through. And then you'll see the numbers pop up. So we have an oxygen saturation of 97% and a heart rate of 49 to 51 beats a minute, which is not what you would not, which is not unexpected for a healthy young individual. Okay, the next thing I'm going to do is take a blood pressure. Okay, so you've got your blood pressure cuff, which has your artery marker on it. This should be overlying the brachial artery of the arm. And the cuff should sit in the upper arm, a couple of finger widths above the elbow crease. If you lift your arm for me, I'm going to place that round. It should be nice and snug around the upper arm. Okay, I'm also just going to pop a towel underneath there to elevate it slightly so that it's level with the heart. That'll just give us the best reading. And then I'm just going to press the button with the blood pressure cuff on it, and it will automatically inflate. So this will take some time. And so the numbers have come up here. So the top one is a systolic blood pressure of 110 and a diastolic of 67, which is well within normal limits. I'll just turn the machine off.